Good morning, good afternoon, good evening. You are welcome to the Discovery Show TDS TV here on Facebook and on YouTube. This is a show that seeks to interview professionals in the diaspora and beyond who are making significant impact in the area of politics, religion, academia, and the likes. Today is another edition, and we seek to bring you accurate information so that your path can be directed. John C. Maxwell said that the happiest people are those who invest their time in other people. And so today we are happy to have one person who has decided to invest her time in other people as well by sharing accurate information with us. Her name is Mrs Akosua Agyenim-Boateng, Mrs Akosua Agyenim-Boateng. And she is a PhD candidate at the University of Salford, and her PhD is on perinatal mental health. And she's also a midwife at Royal Oldham Hospital here in the UK. Akushia, you are welcome to the Discovery Show, TDS TV.
Thank you, precious.
I nearly missed the missus, so congrats.
It's very important for us. So.
Thank you very much. And we are happy to have you on our show, I must say.
Thank you for having me.
Fantastic. I know quite a number of people are watching us. Just tell us a bit about yourself. Who is Akushia?
Right. My name is Akosua Agyenim-Boateng, as you rightly said. I'm a Ghanaian. I grew up in Ghana. I grew up in Kumasi, Santasi for the most part of my life. Then I moved to Accra after school. So I started my education from Great Faith Rockery School up to JHS level, went to St. Monica's Munche at Mampong. Then I went to KNUST to read BSc Midwifery, completed in 2017. I worked at Ridge Hospital and Trust Hospital, Osu, and then I moved to the UK to pursue my master's. Finished my master's in 2021, and then I started working with the Royal Oldham Hospital. Just when I started working, I got a PhD, and so now I'm doing both. Yeah, so that's a bit about me. Yeah.
Wow, that's amazing. Great, great. Congrats on all the achievements so far. I mean, you mentioned you were a midwife, and you had mentioned few hospitals you've worked with back in Ghana.
Yeah.
How is the practice back in Ghana? And by extension, if you have to compare the practice in Ghana to what you are doing now in the UK, are there any differences, any similarities?
Yeah, there is. To be fair, you know, as a midwife, labor is always the same everywhere. Babies come out through the same routes, you know, but in terms of how we manage cases, it's quite different. So for instance, for me, I think what I'm finding really stressful here, I would start with, is the long hours. The 12 hours is killing me. Unlike in Ghana, where you have this 8 to 2, 2 to 8. So I would say I will give that to Ghana. And then in terms of what we do differently, I feel like in the UK, you can't just use your intuition. I feel like in Ghana, we use our intuition for a lot of things. We use experience for a lot of things, but then here in the UK, everything you do would have to be backed with evidence. It will have to be backed with the policies. So I would say practice here is a lot more organized, I should say. And one thing here is also that you would have the opportunity to go for a lot of study days. So you are up to date most of the time. Whereas in Ghana, for workshops, it has to be the matron or the PNO who would go for the workshop and then come and tell you that this is the new policy and all that. So I find a lot of things different in terms of, I always say the policies. I always say you don't just do things because you feel it's right. What is the policy saying? What is NICE saying? And that's really a good tool because we want better outcomes. And so we want to know what research is saying to be able to give our women better outcomes. Whereas in Ghana, it's a bit down on that side. Most of the people use their experience. So you find an HCA in Ghana, I don't know, they used to wear pink or something as confanoche, and they would say, oh, this woman is really good. It could be true that they are really good, but probably what they are doing, because the person has stayed there for a long time, she's really experienced. That's all good. But then it has to be backed with evidence, not just the fact that she's able to deliver babies. Is she using the right approach? What is the long-term consequence? And that's where I will give it to the UK. It's always about what is the long-term consequence? What is the policy saying? So I feel like just in that sense, it's a bit more of the work here is more evidence-based, whereas in Ghana it's just a bit more loose, and then people freely do things just because they did it here and it worked. So kind of that's what I would say. Yeah.
Great. Thank you very much. I mean, if any top nursing official in Ghana is watching you, of course, you've enumerated the positives in the UK, and of course, we deal with context-specific issues. Sometimes certain things need to be adapted for other places to work. What practical approaches, based on your experience in Ghana, and your practical approaches, simple ones, will you suggest so that people watching can implement them?
Well, so practically, I think that, so going back to the workshops, I think that in Ghana, we should allow those who are on the ground to go for the workshop. I don't see why the PNO, who hardly even comes to the ward, will be the one going for the workshops, whereas the staff midwife, who is there 24/7, is just there, and then you come and tell her to do this. She is on the ground. So I think that in terms of workshops and things, they should allow some of these staff midwives to go for those kind of workshops. And secondly, I would say it's also about, you know, when you come to the UK and you're working with the whites, you see the kind of passion they attach to their work. I don't know if you've noticed that. They really want to give out their best. But whereas in Ghana, if we have this term that we say, "Enyame papa dia," and that kind of thing. So we lack it a bit. So I would say in terms of nursing, in terms of midwifery, I think people should go in with passion, because you can't just go in like that and say "Enyame papa dia," because lives are at stake. So I would say that you have to have the passion for the role you are doing. And secondly, I wouldn't also blame the people in Ghana, the staff in Ghana so much in terms of that, because here in the UK, we have the equipment. We have whatever we need to make our work, we have it. But then in Ghana, you have about 20 women and you have only one fake. So these people, these staff are stressed. So I think that in terms of the higher authorities, they should also look at equipping these staff so that they can enjoy their role. And to be fair, if I have 20 women and I have only one thermometer, I will be stressed. What do you want me to do? So it's in terms of that, I think that the higher authorities also need to look at how to make these women, these staff, their roles more interesting, make them more relaxing for them, because they're always stressed, and I don't blame them. Whereas here, even though I spoke about the working hours, which is long, which is quite stressful, but then everything you need is just at the tip of your hand. So it's quite easier for me, yeah. Practically, that's what I think. I think equipment, and then also having the passion, and also letting the midwives go in for the workshops, giving them the opportunities, not just for the PNOs and the SNOs or whatever they call them, but then giving it to the basic people who are on the field is really important.
Spot on. Thank you very much, Akushia. Viewers, thank you very much for joining us this evening, this morning, this afternoon, wherever you are watching us from. This is the Discovery Show TDS TV here on Facebook and on YouTube. This is a show that seeks to interview professionals in the diaspora and beyond who are making significant impact in the area of politics, religion, health, academia, and the likes. And today we are sitting with Akosua Agyenim-Boateng, Mrs. to be specific, Mrs. And she is a PhD student at the University of Salford in the UK. And her PhD is focused on perinatal mental health. At the same time, she's a midwife at Royal Oldham Hospital in the UK. Akushia has told us about her life and also trying to do a comparative analysis of the practice of midwifery in Ghana and here in the UK. There are quite a number of people watching. I will encourage you to drop your comments so that I can acknowledge you appropriately. Secondly, This is a very interactive show. We expect you to drop your comments so that we can, and your questions, of course, so that we can ask our guests. So please do well, and I'll definitely ask for you. There's a certain gentleman who could have missed the show today, Mr. Foster Kwame Amankona, who is the owner of the guest, the owner in quotes, the husband of the woman we are speaking to. So Foster, thank you very much for watching, my guy. Tifreti Richard, Donna Weber, Mrs. Regards to you. Isaac Whiteman, Irajua Brown, Precious Uguchuku, Albert Boateng, Mr. Isaac Nkrumah, my senior. Mr. Nkrumah, regards to you. God bless you. Nanaya Kwansa, thank you all very much for watching. Once I'm able to realize that you are watching, I'll definitely acknowledge you. Akushia, you did mention that you are coming from Ghana. You had undergraduate training in Ghana, and you came here for master's, PhD.
Yeah.
And then you are practicing as well. If there's someone watching us who is yet to go through the journey of midwifery, can the person come here to start an undergraduate midwifery program? And then, of course, so that you can take the time to talk about it, what is the process for getting into a postgraduate study, either a master's or PhD in a midwifery specific area?
So yes, with the first one, yeah, you can come here and start your BSc midwifery here straight away with your OSCE. So that's possible. But I think you would, they have, so it depends on the school actually. So you can check on the school's website and find out their requirement with your OSCE. They need specific grades. It shouldn't be with English and I think maths or something. You need, so the person would have to go to the school's website. I think every school and their requirement, but yeah, that's possible. I know people who came here to start nursing here, that's possible. So you do it for 3 years here. So that's possible. And then with a postgraduate study, so what I'll speak from my perspective. So what I did was, I know there are lots of agencies, educational consults in Ghana or in Africa who help people come here. But I think that people can do it on their own. It's just a matter of, so what I did was I put it in Google, MSc Midwifery. So what came up was a lot of schools in the UK and in Australia. In Australia. So what I did was that I would go to the school's websites, read the requirements, look at what I need, and then I'll start preparing for that. So the first thing is that if you think that you would want to do further studies, so you plan ahead and look at what they want. And then as you're going through your journey, wherever you are, you start preparing the documents. So what I did, so the requirement was that you needed to have written IELTS. So I got about two or three schools. I got Salford and I got Nottingham, and both of them were requiring for IELTS. So they have specific grade that you need to, a band that you need to get for IELTS. So I got that, and then you will need some references, and then you will need the research proposal. So as I said earlier, it's school specific. So you would have to look at what the school wants. And for some schools, you wouldn't need to pay for application fee. So for Salford, I didn't have to pay for application fee. The application is online. You just follow the instructions, just click on apply, and then you start putting in your details, you start getting your references, you start getting your IELTS. I think if you want to do master's or PhD, by now you would have got your BSc or BA certificate. So you put all of that in, and then yes, so I didn't have to apply. I didn't have to pay for application. So it was just straightforward. And I know a lot of people know that applying for schools in the UK is quite straightforward. Sometimes you don't even have to pay for application fee. For Nottingham, I had to pay application fee, but it was just quite straightforward. You just click submit and then you wait for the results. And in terms of, I think that people know all of this, but the problem is the funding, because in the UK, it's quite difficult to get funding. So, but then the process is just straightforward. People have been messaging me, how do I apply? I think it's just straightforward. Whatever you want to do, just go on Google. If it's be an MSc nurse in midwifery, whatever. Just go on Google, put it in. You get a few schools that will come up. Just read about the school, about their performance in that area, and then just apply. For me, I think that's the best way to go about it. Just know that some people go to the educational consult, which is also fine, but it's something that you can do by yourself. So that's what I did. I applied all my schools myself just by going to Google.
Amazing. Thank you very much, Akushia. I mean, just to stretch that a bit, touch that on that a bit, what, I mean, steps or what basic tips will you give to people watching? Because I mean, it looks very easy from what you have said, but if I'm applying, what should I put it out in my statement? What should I highlight to ensure that I am able to get an admission?
Right, that's good. So what I did was that, you know, you have to, so in your, they call it personal statements. I wrote a personal statement and a research proposal. So I think that, so for masters in Salford, they had what they call the modules. So what I did was go and look at the modules, what the modules were about, and try and coin my personal statement and my proposal in that regard. So for instance, if you say that you are interested in perinatal mental health like me, and maybe you're choosing a school, say Manchester Uni, and you go and check their modules, or maybe you write your personal statement around perinatal mental health, and they don't have a module like that, it means that you didn't even research about the school. So I think that you should look at the modules they have, look if it's in your interest or the area you want to go to, and then coin your personal statement, your interest around the modules they do, so that they actually know that, yes, you've done your research and you know that this is great for you. Because I think even when you get the school and you're applying for the visa and you go to home, or is it home office in Ghana or something, they will ask you, why do you think that you want to go to that school? So that's a good way. You should know why you want to choose that school, and that's one of the that's one way to make your personal, to make the person know that you know why you're coming to that school. So basically what I did was look at the modules. I am interested in perinatal mental health. So a school that's not offering perinatal mental health, I wouldn't even go near, because that's what I can defend. So for you, if it's neonatal health or the maternal health, you should look at the modules. And also, I think you should focus on your skills, focus on your achievements. What have you done? Because the people would like to know if this education, it's like the masters you're going to do, is it going to improve your career progression? Is it going to give you a career progression? So you should focus on your skills, your achievements, your strengths, put them in there. And you know, one thing I always say, that if it's me and I'm recruiting, I wouldn't like somebody who always projects their strength. Everyone has a weakness, so there should be a little weakness as well. You are human, so I always do that, and it works for me though. So, but then project more on your strengths, what you do, what you've done in the past few years. I think that's all personal statement is about, and then why you want to choose this, where your interest is. So it worked for me, so that's what I did.
Fantastic, spot on. Thank you very much, Mrs Akosua Agyenim-Boateng, the only wife of Mr. Foster Kwame Amankona. Thank you very much. Akosua is a midwife here in the UK, as well as a PhD candidate. If you are looking for footwear, clothes, watches, bags, and books, look no further than Henbeck Agency. Henbeck Agency. Henbeck is spelled Henbeck Agency. Henbeck Agency. They will supply all your footwear, clothes, watches, bags, and books. And you don't need to worry at all. If you need that to be shipped to you, do not worry. They will definitely ship it to you. You can contact Henbeck Agency on +233 546 022 952. I take that again. +233 546 022 952. Or you can send them an email at henbecktravels@gmail.com. henbecktravels@gmail.com. Or simply visit their page on Facebook, Henbeck Travel Agency. Henbeck is spelled Henbeck. They are the proud sponsors of this program. Please contact them and you will never regret, especially if you want items shipped to you anywhere in the world. Thank you very much for sticking and staying with us here on the Discovery Show TDS TV. You can follow us on Facebook, YouTube. The name is the Discovery Show TDS TV. On Instagram and Twitter, it is the Discovery Show _TDS TV. My name is Precious Adadidudu. I am the host, ably supported by my executive producer, James Oppo. Thank you very much. Few messages so far. This is from Nanaya Kwansa. She says, I am really loving this show. Thank you very much, Nanaya. Oba Efia Presa says, it's been heard that nurses have upper hand in traveling to the UK as compared to midwives. But as you have been able to get there, may I know the approach after a midwife is done with a 1-year mandatory service? Definitely, that is our next thing to talk about. So, Oba, you definitely got it right there. Donna Weber, a senior back in Tech Hospital, KNUST Hospital. She says, nice show. Thank you very much, Donna. Nana Kwame Ofosu says, great interview. Thank you very much, Nana Kwame. Linda Osei says, good evening, family. Good evening, Linda. I can also see a message from Christmas de la Christmas, senior man, doctor. Insightful presentation. Thank you very much, Dr. Christmas. And then I can also, Dorcas Okokwadma, Mrs. Atrim is putting some emojis. Thank you very much, Dorcas, for always being with us. And then, of course, the man himself, Foster Kwame Amankona, the husband of the guest. He says, I love your presentation, sweetheart. Oh, that's so touching. Thank you very much, Foster. You couldn't have missed this. Mercy Osei Owusu says, how do I get scholarships to study abroad? And then I see other people like Abna Chewa are not watching. Mercy Osei Owusu watching. Iradra Brown, Ishraba Mefia watching as well. Albert Boateng, Tochuku Okolo watching. Yeah, I mean, I will acknowledge the others as well. You want to briefly touch on funding, of course. You've spoken about postgraduate studies. If a midwife out there, and we are speaking to a large group of people beyond Ghana, other people in other countries. If anyone wants to come to the UK to pursue postgraduate studies, assuming I already have the admission as you described, what fundings are in place for us? Just tell us, please.
Yeah, so for midwifery, I think that my time, I've not searched in a while, but my time, what I found was Commonwealth Scholarship. So it was actually, it was with Nottingham Uni. And I think that after some time, Salford, my uni also was in. So what I found was with was Commonwealth Scholarship. That's the only thing I could find. I don't know if people know any. And also you can find funding with your school. So we shouldn't be afraid to ask. Sometimes they wouldn't advertise it, but you need to ask. So I know that a school like Nottingham, they have something that they call, is it the Vice Chancellor's Scholarship or something, that will give you 50% off. And my school also has some scholarships. And I know that, so I was researching the last time, I think in Australia, they have a lot of funding for midwives. So the midwifery postgraduate is not only in the UK. I know a lot of people are looking out, coming to the UK, but I think that in terms of scholarship, I've seen a lot of opportunities in Australia with funding. So, but mostly it's with the schools. I don't know any other way except for the Commonwealth. I don't know if Chevening or MasterCard or something, they do that kind of scholarship for midwifery. But I've seen that in the area of public health and nursing, you get a lot of funding, but in the area of midwifery, it's quite limited. So, and yeah, so I think that the people should look at Australia, because I think I've seen a lot of opportunities in Australia, and mostly it comes with research. So it's not just like they give a scholarship out because you want to come and study. They will bring out the research they are doing, and then they want people on board. So you bring your proposal, and then if you qualify, you get the funding. So it's not just here in the UK, but Australia and Ireland, people should look at that area because I've seen that they've got a lot of funding there. And then also don't be afraid to ask your school. Sometimes the school has tuition, maybe free tuition, but then you would have to sort out your expenses of living. So just ask them. You don't always see it on the school's website, but then when you get admission, just email the tuition team. They always have their email. Email them and find out if you get any sort of support. So that's what I would say.
Thank you very much, Akushia. I mean, what you said about Australia, it sounds more specific to PhD because you spoke about having research and they need you on board and all that, isn't it?
Yeah, no, I've seen some masters that, some masters are, so in Australia, it's not always that 1 year thing that we do here. In Australia, some masters are 2 years, and actually they have these short projects that they want people on. Because I think the last time I saw about 2 of them, and it was a master's program in neonate, I think in breastfeeding or something, and it was masters, and it was bringing your proposal. So they have these little things that if you search further, you could find something, to be fair. Yeah.
Great. Thank you very much, Akushia. Now let's zoom into one of the topics that a lot of people are looking forward to. Midwifery recruitment in the UK specifically. Of course, if you know about other places, you can. But on this show, we've already spoken about midwifery recruitment and nursing recruitment in Germany, US, and the UK. Of course, that of the US and the UK were specifically nursing. And then that of Germany was midwifery with a twist to that of nursing. But a lot of people want to know the midwifery journey or route for UK specifically. Have about 10 to 15 minutes. Talk to us about the process. If I'm in Ghana, if I'm in Nigeria, wherever I am, if I want to be recruited as a midwife in the UK, what is the process?
Okay, so I would first start by saying that I saw the comment that somebody said that it's difficult. It was difficult initially, but it's getting better. So it's a good thing. So what I did was that after I told you I came here for masters and all that, but I said earlier that you have to plan. So before I finished my rotation, I knew that I wanted to do my masters. So I started looking for schools, as I said, on Google, and I found out that one of the requirements was that I write IELTS. So I wrote the IELTS, and I was talking to someone, and the person said, oh, you can work in the UK with that. But my initial aim was to go to school. So I started reading about it. So I would say that if you want to work in the UK, I would say that the first thing you need to do is to get IELTS, write your IELTS. And I think it's a band 7 or something, I've forgotten. I don't know if people know. So you write your IELTS, because most of the time people just go ahead. I will come back to go ahead and write the other exam, which is the CBT. But you should know that it expires, and IELTS is the most difficult thing that people find. So if you jump and write your CBT and it expires whilst you've not passed your IELTS, that's the waste of money. So I think that the first thing you need to do is to get your IELTS done. But before that, you need to visit the NMC UK website in the overseas recruitment or something, and then read about it, because it involves money. So you should be prepared before you start the journey, because you don't want to go and write your IELTS and then you get stuck and you know that you can't afford it. Then you've wasted about 2,000 cedis or something like that. So people should go to the NMC website, read about how much money it's involved, and then be ready for that. So when you know that you are ready for that, then you sit for your IELTS. So after I got my IELTS, I wrote the CBT. So that's like a midwifery exam. I think it's changed now. They changed it from August. By my time, it was just basic midwifery exam that if you work on the ward, it's something that you easily find. Like it's very simple. You don't need to stress about that. You pass that easily. Just focus on the IELTS. So after I passed, but before you write the CBT, I told you that register with the NMC. So I think a lot of things have changed now, but that's what I did. I registered with the NMC. I paid £140. Then after I passed my IELTS, so I started the process with the NMC. And then after I passed, they gave me the go ahead to write my CBT. So I got the go ahead from NMC. I wrote my CBT in Accra, I think Total House or something, and then I passed. So after I passed, I pay. I don't know if I paid the registration fee before or after, but then you should know that you pay £140, so you should put that in your budget. So now you have the IELTS, you have the CBT, you have the registration. But I will entreat people to go to their website because things are always changing and read. But then the basic exams you have to write is the IELTS and the CBT. It's no different from the nurses. The IELTS is the same, just the CBT. The questions are midwifery specific. And I think now they've added a bit of maths to it, but I don't think it's an elective maths that will crack you up. It should just be basic. So after that, during my time, you would have to wait for a decision letter, which is now out, I think. But I waited for a decision letter, got my decision letter, which is like a temporary pin, I should say, that would say that, oh, you can come to the UK and then practice for a while. I think they'll give you about 6 months to be able to pass your next exam, and then you can get your permanent pin. So when I got my decision letter, then at that time, I realized that a lot of the nurses were getting agencies to recruit them with a decision letter. So at this point, I've got my IELTS, I've passed my CBT, which is the midwifery exam. I've got these 2 exams. I've registered with the NMC. They've given me a paper to say that I can practice for a short while if I'm in the UK. So at this point, I needed an agency to bring me to the UK, which the nurses were getting at that time. And I couldn't get that. I contacted a lot of agencies and they would tell me that they are not recruiting midwives at that time. It was very disheartening, and I could see a lot of my nurses friends going within 2 days, they've got an agency, they are gone. So then I came back to my original plan, which was that I'm coming to school, and I didn't lose that focus because that was the main reason I wrote the, what do you call it, the IELTS. So I came back to my original plan and I forgot about the working here because I thought it was impossible. So I pursued my schooling. I got everything ready. I came to the UK in September. So when I came, I got a few people around who encouraged me that, Charlie, you have to finish this thing. You've started, you've paid a lot of money. So I've got my IELTS, I've got my CBT, I've got my temporary PIN. Now I have to write the OSCE, which is like a practical assessment where you maybe check somebody's temperature for an assessor to see, or maybe palpate a woman's abdomen for an assessor to see. So
that is just to clarify, objective structured clinical examination. Those of you who are familiar with the examination, practical examination procedure for medical doctors in Ghana, if you are in Ghana, that is what we call OSCE. Yeah, go ahead.
Yeah, so yeah, I think that at that time the OSCE was costing about £750, and I was new here, I didn't have that money, so I forgot about that goal. And you know, with the nurses, when they come with the agency, they are able to go to the ward, get I don't know if they get instructors to take them through the OSCE. I couldn't get that. So what I did was I would walk from hospital to hospital. So I went to a lot of hospitals here in Manchester, trying to tell them that, oh, I'm nearly qualified. If you could help me write the OSCE and recruit me, I'll be grateful. But at that time, I had what they call DBS. It's a criminal check that you don't have any criminal records here in the UK. So they kept telling me I needed a DBS, which I had already, but I don't know why a lot of them were not keen to accept me and all that. So I decided that I would learn the OSCE myself. So my husband was the one who taught me the OSCE. Since it's not different from, so what I would say about the OSCE is that it's not different from the OSCE that the nurses do at all. So we have, I don't know if they had the catheterization, removal of a catheter. We all had the same things, API, we all had the same thing. So as a midwife, what you add to what the nurses do is palpation. So ours was abdominal palpation, and then urinalysis. That was the only thing, that was the two. So it's not different at all. So if you come here and you can't find help for someone to help you do the OSCE, you can consult a nurse and then just learn the palpation yourself. So what we did was, my husband used to teach me, but I needed visualization because the thermometers they used were quite different and things. So I went on YouTube, put in OSCE, and then looked at how the thermometers looked like, how the dynamaps look like. So that was really helpful. So I sat for my OSCE, and yeah, I sat for my OSCE. I think I passed, which I thought I would fail. And then, yeah, you get your pin. So after I got my pin, so I think I've forgotten how much I paid for my pin. I think it's £120 or so. After you sit for your OSCE, my results came in about 3 days. It would say 3 to 5 days. So in 3 days, I passed my OSCE. Then you pay to get your pin. I got my pin, which meant that now I can practice here as a midwife. And that was another hurdle to cross. So after I got my pin, it was really difficult finding job. So I applied. We have track jobs or NHS jobs. I went there. I applied for so many jobs, and I'll tell people that who are in the process that you shouldn't give up. Even if you have just the IELTS and the CBT, apply for the jobs. So I applied for so many jobs. I got so many interviews. Some would tell me that, oh, they are looking for community midwives and I don't drive, so I can't. Some would say I don't have the experience in the UK. So it was quite difficult. I think it took me about a year applying, going for interviews. So I gave up. I told myself that I would rather just continue my school and then just go back to Ghana. I don't care. But it came back again. The energy came back again. I said, well, I need to go. I need to apply again. And God being so good, I applied to about, so the late application was to about 3 hospitals, got an interview for 2 of them, and they all picked me. So, but coming back to the beginning, people think that it's not possible. It's possible, but it is just not so straightforward as for the nurses. Because now I think it's becoming a lot more linear. I know people who had just the IELTS and the CBT, and then they were able to come here, but not through agencies, as people think that you always need the agency to bring you here. Just go on track jobs or NHS jobs. Just apply for the jobs. Apply as many as you can. You get an interview. And I think that the UK needs nurses and midwives. So just apply as many as you can. Sell yourself when, who knows, you get an interview, get a job. So, and I also know someone. So one route is that when you get your IELTS and your CBT, apply as many as you can if you can't fund yourself to come here. I also know someone who got the IELTS and the CBT, applied to come here as a visitor, and applied that they are coming to write an exam. And they came here, wrote their exam. God being so good, they got a job before they could go back. So that's another route. You can get your IELTS and CBT, apply for the jobs in Ghana as many as you can. And I'm telling you, it take a while, but you get it. But make sure that you don't, because these things expire. So make sure that they don't expire while you are still there. Or you can get your IELTS and your CBT and then apply to come here, that you're coming to write the OSCE, because I think that definitely the NMC will give you something to show that you've qualified for OSCE, which you can sit between this period and this period. So you can use that to apply for a visa. Come and write your OSCE. Even if it means that when you are done, just go back. I know somebody who finished OSCE, didn't get a job, went back to Ghana. Now they've got a job, they are coming back. So it's also another way. Or what I did was to come to school. If you want to come and use that whole process, that maybe a 1 year or 2 year period, to write the OSCE and look for a job before your visa expires. That's also another way. So I think that people always ask me, is it difficult? It's not difficult. The process is the same as the nurses. You need to write your IELTS. There's no way you can skip that. Maybe IELTS or OET. Get your CBT done. Get your go ahead to write OSCE. Come and write your OSCE. Get your PIN and look for jobs. That's the problem. You wouldn't get it as easy as the nurses, because you can't work in care homes. You can work in hospitals, and I think they were not keen on taking midwife. But now it looks like it's working, so they are interested in taking us. So just apply as many as you can. Anything you see, apply, and then it will work out at one point.
Wow. First of all, I want to say a big congrats to Foster for all the work he has done. He actually sowed a seed and he's now reaping the fruits. Foster, thank you very much. You've done a great job. But I'll come back to find out the reason why midwives go through that challenging application route. I'll come back to find out that. But just to follow up on what you just said, you had said that it is now improving. What is the difference, and how? I mean, yours has been very stressful. What has been the difference, and what is really working? How simple? I know you've said just apply, but what roadblocks have been removed at the moment to make it easier?
To be fair, I keep asking myself whether it's coronavirus or something. I don't know, because I got a job during the corona period, and I don't know why now it's become a lot easier, because when I was doing it, it was really difficult. Maybe because we've got a few of us around now. So maybe because the nurses, maybe it's probably due to the nurses, the overseas nurses. I think the HR sees that it's working for them. And I think that, you know, when I was, at the time that I was doing when you contact an agency, they will tell you that midwives are not on the shortage list or something.
Waiting list.
Yeah, but now I see midwives there. So I think that that's also something that has changed. Okay. So it's, yeah, because at that time I used to visit gov.uk all the time and I never saw midwives. But a few days ago, I think I saw midwives there. So midwives, biomedical scientists, whatever, they are all there now. So I think that that's a block that has been removed. Now we've been added to the shortage list. So it means that we can come now. And I think that now the HRs are more knowledgeable, because at first they used to give it to the agencies. But I think now the HRs are doing the recruitment themselves. So now you don't normally go through that. So the HRs are more knowledgeable about this aspect. So it's giving us a bit more room. So yeah, I think that's one thing that has been removed.
Fantastic. I mean, you've just adduced, evidence to the fact that midwifery was not on the shortage occupation list. That's the reason why probably it wasn't easier for you. But the main underlying reason, do you think it was a mechanism to probably reduce maternal mortality because they were not too sure about the training regimen for midwives from overseas countries?
Yeah, that's true. Because I remember when I went for one of my interviews, they were so keen about asking me how my training was, how many deliveries I did. Because here in the UK, you have to do 40 deliveries. So they asked me how many did I do. I said, oh, we did 30. And they were like, okay, 30 is close to 40. They were asking me, so how do you manage PPH? They want to know. So I think that they were not quite sure, coming from a low and middle income country, they were not quite sure whether it's a good thing to bring you on board. So what they did was people get preceptorship for 2 weeks. I got a preceptorship for one month to be able to integrate me properly into the trust. So I think that that's also an aspect. They were not quite sure your training, and I don't blame them, you know, just bringing, you don't know what they know and what they don't know, and to leave a mother and baby to them is quite a risk that they are taking. So yeah, I think that's also an aspect, but it's all up to you. And then what I say is that when you come here, you will not be left alone. That I talked about that. The training is there, the preceptorship is there. If you need more time, you'll be given the time. Yeah, so looking at they trying to reduce maternal mortality, yeah, that's true, because they were keen about knowing the deliveries I did. How do I know how to suture? How do I manage PPH in Ghana? Is it likened to their base, and how can they help me, you know? Yeah, so yeah.
Fantastic. Thank you very much, Akosua Agyenim-Boateng, Mrs.
And I would say one thing, sorry, I would say that, you know, I told people to apply for as many jobs and go for many interviews. I think that before you go for your interview, just don't go, you have to read the trust values and things. And also there are a few things you need to know about the UK. So assuming that you are in Ghana, you want to come and work here, that you have to just read a bit more, because in the UK, for instance, in practice, we make reference to a lot of things, like a lot of well-known issues that happen in the UK, well-known research. So those are some things that you will meet in the interview, and if you make reference to them. So I think that where I worked, Odam, my question was on safeguarding. Safeguarding is basically like protecting the vulnerable people. So if you come and hear a word like safeguarding, or if you find a word like safeguarding, and you've not heard about it, you fumble a bit. So I think that while you are doing your application, you should also read more on the practice here in the UK. There are lots of videos you can watch on practice here in the UK, and that will really help increase your chances of getting a job.
Great. That's very, very important. Another word is abuse. If you hear abuse, you may think it's only about whipping or beating somebody, but there are a lot of different types of abuse. So please learn about that. I posted the NHS jobs link in the comment section, and I also posted the link to the NMC website that guides you step-by-step guide on how you can register as a nurse or midwife here in the UK. So please, you can make good use of that. I can see Mami Sewa Ampa for Ajima watching. She says, good job, dear. Albert Boatin says, please, what help can you offer to those interested in coming to UK? So Akushia will come to you to ask if you have any opportunity to offer such support for people, and if people want to contact you, how? Nana Amponsa says, so you can't go without the IELTS, right? This I can answer. Definitely, you can't come to the UK to practice without IELTS. The other thing is Mercy Osei Owusu. Okay, I think we've addressed that already. I can see Michael Opoku watching. Michael, regards to you. Yeah, and then a few other people. Of course, my wife is watching, Dr. Josephine Abuadu-Mensah. Thank you very much, sweetheart. Let me copy from Foster. All right, so Akushia, let's talk a bit about, we've had a lot of discussion and all that. Career opportunities in Ghana. If you're a midwife, what I know is it's either you are practicing on the ward or you are probably teaching in a health training institution or university. What other career opportunities are available for midwives in Ghana and also outside Ghana?
So I think you said it right. In Ghana, well, I didn't practice there for a long time, so I don't know if there are a lot more than that, than teaching and research and what do you call it, and being in the world. I don't know, maybe your viewers can help me out there, but I don't know. But in terms of the UK, I'm telling you that there are so many little corners that you can focus on. So for instance, when I did my master's, you have modules that can make you, that like you specialize in. So when I did my master's, we have something that we call a PMA. You can become a PMA, which is like an advocate for midwives. So you are just like, an advocate for midwives. That's a specialty you can focus on. We have something that we call an IP midwife. So you are focused on examination of the newborn. That's a specialty. There are so many things. You can become a consultant midwife. In my trust, we have research midwives, so they focus on doing a lot of research for the trust to improve the outcomes we give to our women. So you can become a research midwife, you can become a diabetes specialist midwife, you can become a smoking cessation midwife. So there are so many opportunities here in the UK. I can't exhaust them all. Yeah, so I think in terms of career progression, when you come to the UK, there are so many areas you can focus on. You can just grow in that field like that. You can either look at, so I did perinatal mental health. You can become a perinatal mental health specialist where you don't go to the ward. People come to your clinic, kind of. You are not, so it's like a 9-to-5 thing. So, I mean, and you can do a lot of research in that area, become a perinatal mental health specialist as a midwife, so there are lots of opportunities here. I can't say about Ghana because I would say that I didn't work there for long, but just like you and I, what I know is that it's either you are on the ward or you are teaching. That's all I know. I don't know if there are lots. I don't know if there are diabetes specialist midwife. I never heard that. So yeah.
Well, if it has just been introduced, then I don't know. But as far as I don't know.
Yeah, I don't I don't know. I think yeah. Well, it's really interesting how when you come to the, because I used to ask myself, so it's either I'm on the ward or I'm teaching, and I didn't want to be on the ward, so then I'll go and teach. So I wanted to do masters. But if you come here, if you don't want to be on the ward, you find something else doing. Even if you don't want to teach, you find something else doing that will still be in your midwifery route. So you're not just restricted to just being on the ward. There are so many areas you can focus on here.
Great. Thank you very much, Akosua Agyenim-Boateng, who is a midwife at Royal Oldham Hospital in the UK. She's also a PhD candidate in perinatal mental health at Salford University, or University of Salford here in the UK. So she's a big woman, and she's the wife of a single gentleman, Mr. Foster Kwame Amankona, who is happily watching and sending some great messages here. Thank you very much, everyone, for watching. We really appreciate it. Of course, I'm sure you are very much aware from your messages and everything that this is indeed a very good show. And definitely you want to do us the favor by subscribing to our channel here on Facebook and also on YouTube. The name is The Discovery Show TDS TV. And on Instagram and on Twitter, you can follow us at The Discovery Show _TDS TV. Please do so, share, comment, like, and follow us. And definitely, as soon as we start such interactive, such important interviews like this, you will be able to be notified. And then, of course, you can join us and we can get interactive. Akushia, someone had asked what support you have for them. If someone wants to contact you, are you available? I know you are very busy. If someone wants to contact you, do you have any allowance or any time at all? Or how do they contact you, if yes?
Of course. I've got people contacting me on Instagram. You can also contact me on Facebook, Akosua Agyenim-Boateng. If you have any questions, I would answer that for you. Yeah, so yeah, just send me a message and we'll take it from there.
Okay. So Facebook, Akosua Agyenim-Boateng. Instagram, she intentionally didn't mention, but it's Mrs Amanke. Mrs Amanke. All right. Fantastic. You want to spell that for them so they can get this photo?
So it's MRZ_Amanke, AMANKAY.
Fantastic. Thank you very much. Kusi Theophilus Amponsa says, informative show, keep it up. Thank you very much. Yeah, so please do subscribe to our channel. We have a whole lot of great things for you. And then again, we want to tell you that this is the Discovery Show TDS TV here on Facebook, on YouTube, Instagram, and Twitter. Basically, it is a show that seeks to interview professionals in the diaspora and beyond who are making significant impact in the area of politics, religion, academia, anything you can talk about. And we seek to bring you accurate information, guide you so that whatever height you want to attain, you'll be able to do that. It is purely focused on you watching us. And that's why you need to join us on this journey on every single day. Thank you very much. Mercy Osei Owusu says, today is my first time of joining the show, and I must confess I'm in love with the show. Thanks to Mr. Isaac Nkrumah of Garden City University College, who introduced me to it. Mr. Nkrumah is my boss, my senior, and one of the best people on earth. Thank you very much, Mr. Isaac Nkrumah. God bless you. So, Akushia, I know a lot of people have different perceptions about midwives in terms of how they treat patients. We've had a lot of reports. People are abused, they are beaten, that they should push and all that. Are these perceptions misrepresented? Are they erroneous? What do you have to say about that, especially back home in Ghana and to a larger extent in Africa?
Yeah, that's a good question. So I was also thinking, because when I worked, I didn't see any of that, So I was interested in that. So I did a systematic review, which is like bringing the evidence together and finding out if there is any truth in that. So I did a systematic review And I wanted to find out, do midwives actually, are they able to say that they do that, and what is their justification for doing that? So my paper found out that yes, midwives said yes, they sometimes abuse women, which they know is not right, but why they do it is because they are stressed, the workload is so much, women are not compliant, some will come to the facility unprepared, and that stresses them. And they were saying that, so that back to equipment, they don't have enough equipment to work with. And one thing that struck me was that the women themselves some of the women didn't think that that was an abuse, you know. So we, from back home, a lot of women don't know their rights, I should say, in quotes. They don't know that this person is doing to me is wrong. So they think that, oh, it's okay if the midwife gives me a little slap on the thigh and the baby comes out. At least I have my baby alive. And that's what some of the midwives were saying. It's okay if I give her a little slap and the baby comes out alive. But that's abuse. So I think that I wouldn't say I know, but the evidence I got said that, yes, the midwives said they do that because the women, it's okay for them. The women don't fight them or don't argue that, why are you doing this to me? You know, that's not right. They think, they even go back and thank the midwife. Oh, thank you for giving me a little slap. If not for you, my baby wouldn't have come out. So yeah, that also empowers the midwife to give little slaps on the thigh. And yes, so I think that is something that's going on actually, because midwives said that they do it, they give it to, and their main justification was that to keep mother and baby alive. Yeah, but for me, midwifery here, you don't give little slaps on the thigh, and we always get the mother and baby alive. So what's missing back home? That's what I'm trying to figure out, because we don't give slaps, we don't shout at women here, but then we always have them delivering. So I think that there is something missing. It's probably because, I don't know, but today I was just thinking to myself, is it because women here come to the facility knowing what to do at every stage, so they are compliant? Is it that our people back home, they don't know? Is it that we need a little bit of education to the women to let them know that at this stage you have to do this? I don't know. Or is it, so I'm just trying to figure out. But yes, midwives said they do it, and their justification is that they want to keep mother and baby alive, and that they are stressed, and the facility, they are less equipped and all that. And then also the women don't complain. The women think that it's okay if the midwife knows best. So yeah, that's a problem that I found. So I think one of the recommendations is that we should go back on educating midwives on respectful maternity care. We can use other countries like here as a case study, because that's just as I said, we don't do it, but we get mother and babies alive, and even our maternal mortality rate is way low. So what is missing in Ghana? And also, women should know their rights, and women should be educated on the process of labor, so that you don't come and stress the midwife for her to give you a little slap on the thigh. So that's something that should be done. Yeah.
In simple terms, although it is unacceptable universally, it may somehow be, accepted by some, mothers. But if you have an opportunity of traveling to practice anywhere, UK, wherever you do this, you will be in trouble. Yeah. So that's why we said that study about abuse. Don't shout at them. It is unacceptable. Even in Ghana, Nigeria, wherever you are watching us from, please practice respectful maternity care. Thank you very much, Akushia. As midwives, you are the first people any baby or newborn will meet before they come to this world. And so, obviously, a mother will be very excited to give birth to a healthy child, no problem at all. You did a paper on orofacial cleft. That paper, you said having a child with orofacial cleft, initial reaction and psychosocial experiences of Ghanaian mothers. What did you find that a mother gives birth to a child and the child or the baby has orofacial cleft? What were the findings of your research? How were the mothers feeling?
So one of the most talked about initial reaction was shocked. So the
But
women...
before that, if someone is watching us and doesn't know what orofacial cleft is, if you just can explain in basic language to us.
So, well, in basic language, I think that cleft is just when there is a gap in the lip, when you have a baby, a gap in the lip or inside the mouth, in the hard, the root of the mouth, like up there. So if you have a baby where the baby comes out and there is a gap, it means that during the formative years, the tissues didn't come together. So the mouth didn't really close well. So that's basically cleft lip. So going back to my study, I wanted to know that how do women feel when, you know, you think about normality in quote, and then you are looking forward to having this beautiful boy or girl, and then the baby comes out and you find that there is a gap in the lip or in the mouth. What is the reaction? So one thing that was talked about, a very big theme was shock. The women were in shock because most of these women said that they did all their scans, they took all their tablets, but then they have a baby coming out with cleft. So they were in shock that why couldn't the scan detect it? So I think that was the main theme that the women were talking about. And also the stigmatization attached to cleft was really serious. In our study, we found women who were relocating from where they lived to another place just because they didn't want people seeing their babies. We had marriages breaking because people thought that these babies are gods or something. So it was more of the stigmatization and the shock. So I think that, and it caused a lot of problem. And so, but the women came back saying that, so midwives are not always bad. The women came back saying that they were really supported by their midwives who helped them with the feeding and all that. But going forward, you know, these babies don't stay in the facility forever. They go home. And then that's where the stigmatization and the stress comes from. Women thought about killing themselves, throwing their babies away. So it was a more of stigmatization. And so I think that now the campaign is out there. People know that clefts can be repaired. I think we have a lot of when I was in Ghana, we had a lot of shows on TV, even some shows by Vodafone and MTN. So I think probably I should go back and see how it is now, if it's gone, is the stigmatization has gone down. But I think generally people should be educated, especially the partners, because as women, whatever you give birth to, you will love it, in quote, but the men tend to think that it's the woman's fault. So in my study, most of the men thought that it's the woman's fault that they had such a baby. So I think that in as much as midwives or health professionals talk about normality to pregnant women, I think we should make a little bit of room to talk about what if there is an abnormality. It's okay, we can manage it. We have a team here. Let them know that even before they give birth, I think that we should let them know that we can support them in whatever the outcome is.
That's an interesting research, seriously. And I really like what you said. I mean, there should be some allowance to talk about what if, because I think most times we are so fixated on only the normality. We don't prepare people psychologically.
Yeah.
And so that's a good one. Thank you very much, Akosua Agyenim-Boateng, a PhD candidate in perinatal mental health and the wife of Mr. Foster Kwame Amankona. Thank you very much, Mrs. Amanke. Mrs. Atrim, who is Dr. Akosua Agyenim, says this slaps and shouting is very bad because it adds up to the emotional stress of the mother at that moment. She's also a midwife, so thank you very much, Dorcas. And then Irene Fosuhima Bosman says, thanks for sharing your experience with us, Mrs. And of course, you are the mischief. I like the host suit. Thank you very much, Irene. Thank you. Then Asante Berima Yao Efrifa, my senior man, says, oh, I like your suit, boss. Thank you very much, Irene and Efrifa. Thank you very much, everyone, for watching. I mean, Akushia, I've really enjoyed this interview. And of course, the comments coming are really supportive of this, that you've been very expressive. You've opened up to us and you've really shared some great insights with us. We really appreciate it. Is there anything I didn't ask you that you want to talk about?
Not really. I think we've exhausted everything, but then I'll go back to the job application. I think people are so discouraged that it's not possible. But I always say that what is the harm in trying? Because that's why I told myself. I got so far that I wanted to give up. But I said, well, if I get it and I don't get a job, I know that I've done my best. So whoever is watching that's a midwife that wants to come to the UK, go to Ireland, wherever, I think that there is no harm in trying. If you have the means and you have the great passion to try it, just go forward, just go for it. I never thought that I'll get a job at any point in time. I thought it was all closed for me, and I made up my mind that, well, I'm going back to Ghana, I'm going to do something else. But it worked out in the end. So people are telling me, oh, I'm discouraged. Don't be discouraged. They worked for me. Why wouldn't it work for you? And I know people are coming now. So if you want to do it, don't dilly-dally. Just start your IELTS, go about your CBT, and there will be a way out very soon.
That's amazing. Thank you. I'll come back for your final words. My brother Prince J. Balfour says, informative presentation. Thank you very much, Prince, for always being very supportive of this program. Eunice Ampabin Sikafo says, hi, Akushia, interesting research. This slaps, eh? Abaya Baba says, good show. Thank you very much. And of course, this is the Discovery Show TDS TV here on Facebook and on YouTube. On both sides, it is the Discovery Show TDS TV. On Instagram and on Twitter, it is the Discovery Show _TDS TV. Kindly subscribe to our channels, follow us, comment on our streams, like, share with other people, and of course, recommend to other people as well. Of course, you can testify it's a good show. And this show is ably produced by Mr. James Kwabena Opon, who is the executive producer. And the show is proudly sponsored by Henbeck Agency. You can contact them on +233 546 022 952 or Henbeck Travels. Henbeck is spelled HENBECK. Henbeck Travels @gmail.com, or just go to their Facebook page and search for Henbeck Travel Agency. And if you contact them, you can get your footwears, your clothes, your watches, your bags, and your books. And you don't need to worry. Wherever you want it shipped to you across the world, they will do a good job and send it to you. Henbeck, truly a world of endless possibilities. Akushia, any final words for us? And of course, I want to encourage the guys on this platform who are on the lookout that Foster did the good work by teaching Akushia OSCE. So you can also adapt or adopt someone who is preparing for NMC, and then of course help them with OSCE and all that. And who knows, can become the missus, isn't it, Akushia? Don't you agree?
Oh. So finally, I want to say thank you so much for having me on the show. And I want to encourage all the midwives that there is opportunity, you can come here. And I just want to say that if you want to contact me, feel free to contact me on Facebook, Instagram. I will reply to your messages. So yeah, thank you so much. I really enjoyed the show. Yeah.
Fantastic, fantastic. I'm so impressed. I'm so happy that you were able to make it despite your tight schedules. And we look forward to probably sitting with you another time. Viewers, we cannot thank you enough. Thank you so much for staying with us. And I mean, sending in your comments, liking, sharing, and all that. We genuinely appreciate. Recommend this page to other people because we have a whole lot of things installed for you. And it's not just about health. It's not just about midwifery. It's not just about nursing. A whole lot, any field at all, provided we are able to get the guests to come on the show. We will definitely bring people that are, able to give you the right information. Mercy Ose Owusu Akushia says, you will be my mentor, Mrs. So Akushia, you are now a mentor to someone, and we are looking out for that. So thank you very much, Akushia. I really appreciate your time. On behalf of my executive producer, Mr. James Kwabena Opon, and myself, and the TDS show family, we want to say a big thank you. And thank you to your husband who allowed you to come for this show. Thank you, Foster, and God bless you. See you some other time, Akushia. Thank you, viewers.
Bye.
And bye-bye. Thank you.